So good morning, ma'am. I am Judith Ramos, and today I will be your student nurse and I will be performing the oxygen therapy checklist. So first off, we are going to start with our assessment. So I will be assessing immediate respiratory status of the infant, including symmetry of the chest wall, expansion, chest wall abnormalities. So I could see that there is a decreased chest wall movement and that there are and I will also be assessing the temporary conditions affecting the ventilation, the respiratory rate, even the vital signs if needed, the rate and depth of sputum production and lung sounds. So there is a decrease of chest wall movement, and I could be hearing crackles or decreased lung sounds, and there is also an increase of respiratory rate, and also if there is an increase of sputum production or hypoxia, this could indicate that need for non-invasive ventilation to improve the oxygenation. Next, I will also be observing for patent airway, and I will be also removing secretions by having the patient cough. So it's either by coughing or by expectorate mucus or also by suctioning. And secretions plug the airway, decreasing the amount of oxygen and that is available for gas exchange in the lungs. So after suctioning the infant, I will be also checking the doctor's orders for oxygen, noting delivery method, flow rate, and duration of oxygen therapy. So I've already ensured safe and accurate oxygen administrations done by the doctor's orders. So pretending that I've already checked the doctor's orders. So in need for oxygen therapy. Safe oxygen delivery includes the 6 rights of medication administration. Okay, so next off, I will be explaining the procedure to the patient, and since our patient is an infant, I will be explaining the procedure to the family. So ma'am, today I will be performing the oxygen therapy, and this is extremely beneficial for those who currently experience low oxygen, katulad ko ng inyong anak, regardless of the reason, and if needed, regular utilizing oxygen therapy can allow people to be more active and mobile by decreasing shortness of breath. So in explaining the procedure, this increases the compliance and cooperation of the patient. Next off is I will be choosing appropriate equipments for the patient's specific needs, and since we are out of equipments here, I will be using this, and this ensures safe and accurate oxygen administration. Next is I will also be checking the environment for safety, and since we are locked inside a room, and this helps to know that oxygen supports combustions and we are avoiding that. Any smoking, open flames, electrical equipment that emits sparks, synthetic fabric that build up the static electricity, and oils are not permitted around any oxygen delivery devices inside the hospital. And next, for the implementation, I will be performing hand hygiene to help reduce transmission of microorganisms. We will be attaching the oxygen delivery device. So I will be attaching the oxygen delivery device, which I already did. Since our equipment is incomplete, let's just attach it here. In the meantime, assuming that it is already attached. And to the oxygen tubing, and attach it to the humidified oxygen source. So already attached all of it here, and I will be turning on the oxygen to the prescribed flow rate and to test the flow. So, tinetest natin yung flow rate, assuming that's already open, and humidity prevents drying of nasal and oral mucous membranes and airway secretions and ensure the correct oxygen delivery. Next, I will be following the procedures for the equipment I am using and position the tips of the cannula properly in the nails and adjust the elastic. And adjust the elastic headband. I will be adjusting the elastic headband or plastic slide on cannula or face mask so that a snug, comfortable fit is achieved. And this, the direct flow of oxygen into patient's upper respiratory tract, and patient is more likely to keep device in place if it fits comfortably. So, ayan, na-adjust ko na. Next is I will be assessing the patient's breathing and adjusting the equipment if necessary to ensure delivery of prescribed oxygen therapy in conjunction with the specific cannula or mask. Next, I will be explaining the safety precautions to the patients and watchers na mga bawal po mag-smoking dito or any spark smoke because the oxygen is on pulse. And I will be also be explaining it to the family as well to increase compliance and cooperation of the patient and watchers to ensure the safety as well. Next is I will be observing the external ears of the patient, the bridge of the nose, the nares and nasal mucous membranes for evidence of skin breakdown. And oxygen therapy sometimes causes dryness of nasal mucosa, and the delivery device can cause skin breakdown where the device delivery comes in contact with the face, neck, and ears. And especially I will be staying with the patient until it is safe to leave to confirm that the patient is already safe and has stable vital signs. And next I will be posting an oxygen in use sign at the door. Ayan. Okay. The door. There's a door. To let the visitors and other workers in the hospital know that oxygen is used inside the room. Next, I will be performing hand hygiene. And lastly, we will be evaluating the following criteria: the oxygen and perfusion, arterial blood gas, and the mental status. And we could do that by checking the RR of the patient or checking if the patient is cyanotic, and we could also be checking the nails of the patient to see the blood circulation of the patient and also the mental status. And we could also use the electronic thing. The continual monitoring with pulse oximetry, which is the electronic pulse oximetry, is required for patients on oxygen therapy. And APG can be checked but not frequently measured as it is an invasive procedure. And the mental status or level of consciousness evaluates patient's response to supplemental oxygen. As the patient's level improves, physical signs and symptoms improve. So that is it for our oxygen therapy checklist, and thank you. God bless.